प्रोसीजर है प्रोसीजर ऑन एपिजोटमी। एपिजोटमी की सबसे पहले इंट्रोडक्शन देखेंगे हम। इट इज़ ऑल्सो नोन एज पेरिनेक्टमी इज़ अ सर्जिकल प्लान्ड इंसिजन ऑन द पेरिनियम एंड द पोस्टीरियर वाल ड्यूरिंग द सेकेंड स्टेज ऑफ लेबर। डेफिनेशन इसकी अ सर्जिकल प्लान्ड इंसिजन ऑन द पेरिनियम एंड द पोस्टीरियर वेजाइनल वाल ड्यूरिंग द सेकेंड स्टेज ऑफ लेबर इज़ कॉल्ड एपिजोटमी, जिसे कि हम पेरिनेक्टमी भी बोलते हैं। इट इज़ द मोस्ट कॉमन ऑब्स्टेट्रिक ऑपरेशन परफॉर्म्ड। इसके कुछ पर्पसेस हैं: टू इनलार्ज द वेजाइनल इंट्रोइटस, टू फैसिलिटेट ईजी एंड सेफ डिलीवरी, टू मिनिमाइज रप्चर ऑफ पेरिनियल मसल्स, टू रिड्यूस स्ट्रेस ऑन फीटल हेड। इंडिकेशंस है इसकी: रिजिड पेरिनियम, बिग बेबी, शोल्डर डिस्टोशिया, एंटिसिपेटिंग पेरिनियल टेयर, फोर्सअप डिलीवरी, वैक्यूम डिलीवरी, फीटल डिस्ट्रेस एंड ब्रीच डिलीवरी। एंड इसके कुछ एडवांटेजेस हैं। Maternal and fetal. Maternal, it is controversial whether routine episiotomy has got any mere benefits. Clear and controlled incision is easy to repair and heals better than a lateral wound that might occur. Shortening in the duration of second stage, reduction of trauma to the pubic floor muscles that reduce the incidence of prolapse and perhaps urinary incontinence. Fetal में है, it minimize intracranial injuries especially in premature babies or after coming head of breech. Types हैं इसकी कुछ: mediolateral episiotomy, median episiotomy, lateral episiotomy and J-shaped episiotomy. Mediolateral episiotomy क्या होती है? Downwards and outwards from the midpoint of the forechat, easy either the right or to the left about 2.5 cm from anus. Median होती है incision from the center of forechat and extend about 2.5 posteriorly. Lateral होगी इसकी: incision start from about 1 cm away from the center of forechatal and extends laterally. It has get many drawbacks including chance of injury to the Bartholin's ducts. J-shaped होती है: incision begins in the center of forechatal and directed posteriorly along the midline for about 1.5 cm and then directed towards and outwards along the anus sphincter. Thus only mediolateral or median episiotomy is done commonly and as such their relative merits and demerits. Equipments इसमें जो यूज़ होते हैं वो कुछ ऐसे हैं: sterile gloves and gauze wraps and tampon, needle holders, sponge holders, scissors, 10 ml syringe, toothed forceps, suture material 1%, lignocaine, sterile drape. इसका प्रोसीजर है, हम देखेंगे अब। सबसे पहले क्या करते हैं? द पेरिनियम इज थ्रूली स्वाइप्ड विद एंटीसेप्टिक सोल्यूशन. 2 fingers are placed in the vagina between the presenting part and posterior vaginal wall. The incision is made by straight or curved, blunt pointed sharp scissors. Incision should be made at the height of an contraction. Cut should be made starting from the center of forechatal, extending laterally either to the left or right. It is directed diagonally in the straight line with runs about 2.5 cm away from the anus. If delivery of head does not follow immediately, apply pressure of the episiotomy site. Perineal repair कैसे होगी? Repair is done soon after the expulsion of placenta. Purpose है to control bleeding, to prevent infection, to assist wound healing. Layers of perineal repair: vaginal mucosa and submucosal tissue, perineal muscle, skin and subcutaneous tissue, suturing the vagina. Identify the apex. Insert the inchoring suture 0.5 cm above the apex. Repair the vaginal wall with a continuous non-locking stitch. Suturing the perineal muscles. Check the depth of trauma. Repair the perineal muscle in 1.2 layer, the same continuous stitch. Suturing the skin. Reposition the needle at the inferior end of wound. Stitching are placed below the surface of skin. Immediate care क्या देंगे इसको? Inspect the repair to check that homeostasis has been achieved. Remove the vaginal tampon if used. Account of all instruments, swabs and needles. Discard sharp safely. Apply sterile pad falling through perineal wash. Wait of minimum 1 hour to shift the patient to ward. Check the bleeding and urine output. Postnatal care, health education. Eat a diet high in fiber and fluid to prevent constipation. Ask to women to walk with thigh opposed. Not to use a squatting position since the round is healed. Perineal hygiene: change sanitary pads at least every 4 hours to help prevent infection. Liquid warm water over the perineum beginning at the from and moving towards the back. Sit in tub of warm water. Always wash hands thoroughly before and after going to the washroom. Always clean the wound clean and dry after each urination and defecation. Kegels exercise. Squeeze the perineal muscles as if you were trying to stop the flow of urine. Hold for 4 to 10 seconds and then relax to do exercise 10 times a day to regain muscle strength. Complications of vulval hematoma, infection, wound, dishenescence, dyspareunia, scar, endometriosis. मैंने इसकी बायोग्राफी है. Dr. J.B. Sharma, midwifery and gynecological nursing. Anchal Publishing, page number 89 to 92. Thank you.